Assalamu alaikum dear students. This is Dr. Ambreen, the course instructor of the course Physical Agents and Electrotherapy 1. This is the part 2 of the shortwave diathermy, in which we are going to continue the remaining discussion over it. So firstly, let me tell you about the learning objective of today's lecture. After the end of this session, you would be clear that what is shortwave diathermy and what is the significance of the capacitive plate method of the shortwave diathermy. What are the effects that are effective in the capacitive plate method? We'll also discuss about the methods of application and application techniques along with the contraindications and precautions and adverse effects. In the previous lecture, we discussed about what is shortwave diathermy. So let me revise it once, then we will move towards this part of the session. We said the shortwave diathermy is one of the examples of the high frequency current. Mean the current which have a frequency greater than 10,000 Hz, and this type of the current are basically responsible to produce the heating effects because they are not able to stimulate any nerve muscle. So when they are not able to stimulate any nerve muscle, so there was an idea that then what it does do actually with the so high frequency, these currents are going to create oscillations, and these oscillations are going to bring about the heating effects. And this is the reason that we are going to use shortwave diathermy and microwave diathermy as heating modality, as they do have high frequency. And we discussed about different parameters of the shortwave diathermy, among which we said the commonly used frequency of the shortwave diathermy is 27.12 MHz with a wavelength of 11 meters. Then we have also discussed about the modes of shortwave diathermy, that it do have pulse mode and it do have continuous mode. We also discussed in the last lecture that what is the significance of the thermal effects and what is the significance of non-thermal effects. Then we have divided the shortwave diathermy into two applications, or like inductive coil method, the other one is capacitive plate method. And the inductive coil method, we said it is a type of the method in where there are inductive coils and over which there is a flow of alternating current. And the flow of the alternating current is basically responsible to produce magnetic field around that coil. And that magnetic field is responsible to produce eddy currents. And the induced eddy currents in the tissues are going to produce the heating effects or the oscillations. And this is what is basically the working of inductive coil method. Today we are going to continue with the other application method, that is capacitive plate method. So we are going to discuss in details of the capacitive plate diathermy applicator, that what does it do, how does it produce its effect, what is basically the mechanism or what is basically the physiology behind this capacitive plate diathermy method, that how it has been related that it is going to produce the heating effect. The capacitive plate diathermy applicators are basically made of metal encased in the plastic housing or carbon rubber electrodes that are produced between the fat pads. A high frequency alternating current is going to flow from one plate towards another through the patient. And now the patient is the part of the circuit, and it produces electric field, and the flow of the current in the body tissue is in between the plates. Thus, the patient becomes the part of the electrical circuit containing the two plates. As the current flows through the tissues, it causes the oscillation of the charged particle, and thus an increase in the tissue temperature do occur. And in this way, we do get heating effects. Heating by the capacitive applicator is also known as heating by electrical field, because the electrical currents that generates the heat is directly proportional to the electrical field. While in the inductive coil method, we said it is a heating by magnetic field, because the magnetic field is responsible to induce the eddy currents that produces the heat. So the main criteria there was magnetic field, and the credit goes to the magnetic field. Here, the credit goes towards the electric field, and we say it that this is an electric field method because the electrical currents are going to generate the heat directly by the electrical field. So when a capacitive plate type of applicators is being used, current will generally concentrate in the tissues and will not penetrate as effectively to the deeper tissues. So it produces more heating in the superficial skin and superficial structures as compared to the inductive applicator that produces more heat in deeper tissues. Let me show you different types of the electrodes that are being used in capacitive applicators. They may be either flexible metal plates, or they may be rigid metal discs or disc electrodes that are being used commonly in the practice. So if we summarize this capacitive applicator, in which the patient is basically been placed between the two metal condenser plates that achieves a high temperature and water-poor tissues like adipose tissues, ligaments, tendons, joint capsules and bone. So these are those tissues which are heated more by the use of capacitive plate applicator method. This one is the summarized discussion over the capacitive applicator. Like in this picture, you can see there is a forearm over which there are two electrodes that have been placed. And among these two electrodes, there is a flow of electric field lines, and this would be said to be the line of forces. And this would be said to be the electric field in this area. And we call this capacitive applicator as electric field diathermy, where we uses the patient's tissue as a part of the circuit, and the tissue's electrical resistance produces the heat. It selectively heats the skin, and the muscles are also being heated via the conduction from the adipose tissues. Also, this one is referred as condenser field diathermy. The other half of this picture is going to show you the cross-sectional view of the application of the capacitive plates around the forearm, where you can see there are the line of forces that are coming from one electrode and moving towards the other electrode, and the patient is a part of this circuit, and patient is basically going to be the main part of the circuit within the confines of these electrodes. Let me tell you about few guidelines for the electrode selection and the placement. Always remember, the electrodes you are going to use should be of equal size, slightly larger than the body part. The electric field is less uniform at the edges of the plate and equidistant at right angle to the skin surface. So these should be the normal guidelines when we are going to use capacitive plate. Now I'll let you know about the electrode arrangement in capacitive applicators. There are basically three types of the applications of the electrodes arrangement. Like number one is contraplanar, the other one is coplanar, and the third one is crossfire application. Now we'll discuss what is this contraplanar, coplanar and crossfire application or electrode arrangement. Contraplanar application include the transverse placement of the electrodes, or you can say electrodes are placed on either side of the limb. Like in this picture, you can see the electrodes are placed opposite to each other around the knee. One of them is placed medially, the other one is being placed laterally. And the coplanar application is basically the method where the both electrodes are placed over the same side of the limb. Like if the patient is lying in a prone position and you are going to place the both electrodes over the back of the patient, then this would be the coplanar application of the electrodes. And the third one is crossfire application, and we will be discussing this crossfire application soon. Now I will enlighten the factors that are going to influence the field distribution. There are three basically factors that do affect, that we have to look for those factors. We should have an understanding that how the spacing is going to influence the field distribution, how the electrode size is going to influence the field distribution, and how the metals can distort electrical field. We will be discussing every factor now. The first factor we have is spacing. Firstly, let me know what is the significance of spacing. Spacing allows the line of forces and electrostatic field to divert before entering the tissues, and thus prevents the concentration of the heat in superficial tissues, in order to ensure more heating throughout the part. In the picture that is shown on your screen, you can see there are three types of the spacing. First one is normal spacing, and you can see here in this case there is an even distribution of the field. The second one is increased spacing, the D field concentration. And the third one is whenever there is decreased spacing, there will be more concentration of the line of forces over the superficial tissues. And when there is an increased spacing, there is a more concentration of the field in the deeper tissues as compared to the superficial ones. Can be provided by wrapping the flexible towel, by the flat felt spacing paths between the pad, electrode and skin, and it can be either the air when you are using space plates. The next factor we have is electrode size. We will be discussing that how the electrode size can affect or influence the field distribution of the short-wave diathermy. We must consider the size of the electrode, that either it is small, large, or either it should be slightly larger than the body part. If the electrodes are too small than the diameter of the treated part, the line of force will concentrate superficially, as you can see over the first half of this picture. But if the electrodes are markedly larger, the line of forces will be lost in air and they are going to be wasted. Ideally, the electrodes should be slightly larger than the body part so that the electrodes are going to cover that area. But sometimes we may use different sizes of the electrodes. Like I may select according to my choice that one electrode is larger in size and the other electrode is smaller in size. To concentrate the heat on one aspect of the part, the electrode should be of unequal size. The smaller one is being placed over the area where the concentration of the heat is basically required. You can also produce the concentration of the heat by using the equal size electrodes but with unequal spacing, like 25 millimeters over the concentrated area and more than 30 millimeters on the other electrode. The third factor that we have is the metals. Basically, the metals are responsible to distort the field of distribution. Metals causes the line of forces to concentrate on the metal. Therefore, the field is going to be disrupted, or therefore it is going to cause more concentration of the heat around the metal, due to which there would be burn and there would be chance of the internal burns around the metal because the metals have high thermal conductivity. Slide 23. Let me tell you something more about the therapeutic variations in the field of distribution. Now let me tell you about the therapeutic variations in the field of distribution. Here we will discuss about the coplanar application, how it is going to affect the field distribution, how should be the contraplanar arrangement, and what is crossfire application. The coplanar application is being used to treat the body structure on one aspect of the body, and if the spacing is less than 25 millimeters, there would be more concentration in the superficial tissues. And if the spacing is being increased, there would be more depth that is being achieved. Ideally, the distance between the two adjacent electrodes should be slightly greater than the sum of the sizes of the two electrodes. I am going to repeat this term that I said ideally the distance between the two electrodes in the coplanar application should be slightly larger than the sum of the sizes of the two electrodes. Like over the picture, you can see if there is an electrode A and there is an electrode B, ideally the distance between these two electrodes should be more than the size of the electrode A and the size of electrode B. Because if they are more closer to each other, there will be less field of distribution. But if they are more, or they should be at a standard distance, then there will be equal distribution of the field both in the superficial and in the deep tissues. Here we are going to discuss about the contraplanar application method. In this contraplanar application method, there are two flexible paths or two space plates or flexible paths that are being placed opposite to each other. Like in this picture that has been displayed over the screen, these electrodes are placed over the both knees. That one is being placed over the right knee and the other one is being placed over the left knee. And the both knees are together and there is a towel that has in place between these two knees in order to absorb any perspiration if it would be. We may use this over one knee, that by placing one electrode over the right side of the knee, meaning over the lateral side of the knee, the other one over the medial side of the knee. We may use it over the shoulder, one anteriorly, the other one posteriorly. So this could be over our choice that where we want to apply, but ensure the contraplanar method is where we are going to place these two electrodes opposite to each other when they are facing opposite to each other. The contraplanar application is one of the most satisfactory methods that is especially for the treatment of the deeply placed structures. Now, let me enlighten something about crossfire application of the short-wave diathermy, where half of the treatment is given with electrodes in one position. Then the electric field is being changed so that the electric field lines at a right angle so that they may produce effect during the other half of the treatment. For the knee joint, half the treatment would be given with electrodes over the medial and lateral aspect. You're going to place the electrode in the one half, one over the lateral side, the other over the medial side. And on the other half of the time duration, we are going to place one electrode anteriorly and the other one is going to be placed posteriorly. And this figure over your screen is going to show you the description about the crossfire application method. Crossfire method is basically being used to treat the walls of the cavities containing air, like pharyngeal sinuses, maxillary sinuses, or ethmoid sinuses. This is preferably being used for such conditions like sinusitis of the pharyngeal sinus or maxillary sinus or ethmoid sinus. The line of forces passes through these tissues between the electrodes but avoids their flow from the cavity, as the air within it has low dielectric constant. Thus, the wall of the cavity that faces the electrodes are not being treated. The crossfire application is preferably being used for the sinuses. For the treatment of the sinuses, the space plates are positioned diagonally to each other. After half of the treatment time, the positions are alternate, and this ensures that all the specks of the sinus membrane are being heated. Care must be taken to avoid the direct placement over the eye, over the uterine disorders such as dysmenorias. And if the position of the electrode is then changed so that the field lies at a right angle to the previous one and these walls are heated. And if this treatment is going to be performed over the face, the patient with the contact lens should be asked to remove the lens because the heating may affect or may melt the lens. Here over the screen you can see the placement of the electrodes that are being arranged in a diagonal manner. One set is in the diagonal manner to the other set. And these are for different types of the sinuses that are being targeted according to our choice. The crossfire method is also being used for the treatment of the deeply placed structures, particularly if they lie in the extensive vascular areas like pelvic organ. The dielectric constant of the vascular tissues is very high and the cross-sectional area of the part is actually larger and the electrodes, so the field spread in these tissues is much wider. Here you can see the application using the diploid electrodes, where the adjacent wings of the diploid are parallel to the skin of the treated area and the electromagnetic field will produce in this area. Now let me tell you about the techniques of the application of the short-wave diathermy, that how we will proceed this procedure. For this, initially we will do some preparations that may include the machine preparations and the patient preparations. So far the machine preparation is concerned. For this purpose, we should ensure the correct connections of the cable, ensure that the cables and the applicators are in place at metal surfaces, ensure the appropriate alignment of the applicator for the maximum energy transfer, ensure that the cables are enclosed to untreated areas, ensure that the patient's port is in metallic and all the metal objects are kept at least 30 cm away from the applicators and the cables. And when we are going to use condenser plates or condenser electrodes, their arrangement is also important. As far as concerned is contraplanar arrangement of the electrodes, they are to be arranged opposite to each other with a gap in between them. Operator should also place his or her hand between the electrodes and switch on and tune the machine and increase the current until the comfortable warmth is being felt. When the cable method is to be used, it may be arranged in a single loop and tested with the neon tube, which lightens up when the two circuits are in resonance. And this is going to tell about the functioning of the short-wave diathermy. Now we are going to move towards the patient preparations. For this, we should ensure the absence of all the contraindications, remove all the jewelry, clothing, coins and other metallic items from the patient. 43. For personal safety, remove your rings, watches and bracelet as well. No metal can be within the immediate treatment area. Keep the patient out of the reach of any metallic object that can serve as ground. Actually, the metals are liable to distort the electrical field, so they are going to disrupt the field. They are heated by the currents which may be induced in it. So we should avoid the metal in contact at that area. Clothing should be also removed from the area you are going to treat. Actually, it may be slightly damp from the perspiration, and its presence would interfere the circulation of the air as well. Tight clothing could interfere the flow of the fluid through the area and may cause overheating. If the clothing is not removed, necessary inspection of the skin before and after the treatment is not possible. The skin electrode distance can't be judged accurately and makes it difficult for the patient to appreciate the sense of warmth. And so far, the metals and moisture are basically concerned. They both have high dielectric constant and a localized area of, and they may either cause the distortion of the electrical field resulting in overheating. Metal objects and anything damped should be removed from the vicinity area to be treated at least 30 cm away from the subject or object. We will also discuss the relationship of short-wave diathermy with wounds and sinuses. Wounds and sinuses must be cleaned. They should be covered with a dry dressing before commencing the treatment. If the area is damp, the moisture on the surface of the skin is heated quickly and give rise to sensation of the warmth, and which may limit the intensity of the current. So far concerned as the position of the patient in most appropriate manner for the body area being treated. The position of the patient should be comfortable because the patient is usually the part of the circuit that is being treated, and the part to be treated should be fully supported, as the movement may alter the skin electrode distance and may affect the spacing of the electrodes. Skin sensation may also be tested before the first treatment. If defected, it's unwise to apply the short-wave diathermy treatment or any other heating treatment. 8 must also be removed, left well far from the machine, and induced currents may damage them. In order to prevent the burns, cover the area with a dry terry towel, and this provides spacing between the source of the short-wave diathermy and absorbs the perspiration, and a portion of the treatment area must remain visible to check for the burns during the treatment. Always explain to the patient that mild warmth they are going to feel, and instruct the patient to inform you if there is any unusual sensation they are going to experience. Let me enlighten some of the dangers that we may experience by the use of the short-wave diathermy. The most commonest adverse effect that has been seen by the use of short-wave diathermy is the burn. Patient may also experience scalds or faintness due to decrease in the blood pressure. Short-wave diathermy sometimes may precipitate the gangrene if the area of the blood supply has poor blood supply. Sparking if one of the electrodes touched while the application of the current. The patient may experience electrical shock. And in case of overdosage, there may be somehow increase in the pain instead of decreasing the pain. Let's summarize today's lecture. In today's lecture, we have studied about short-wave diathermy. We have continued with the other part, that is capacitive plate method, in which we have studied and how these capacitive plates are going to work, how the field of distribution is being affected, how the spacing, the electrode size can affect the field of distribution. We will also discuss about the dangers of the short-wave diathermy and also discuss about the application of the short-wave diathermy that includes the contraplanar arrangement cope-linear arrangement, and the crossfire application. With this, I'm going to wind up today's session. If you have any queries, let me know in our next interactive session or email me at my email ambreen.iqbal@usa.edu.pk. Thank you. Allah Hafiz.